I'm a doctor, medical educator, and a social media evangelist. My challenge? To use social media for health promotion as a platform to improve health literacy. How? By posting about endocrine conditions in Filipino on Facebook. With 117,000 followers, I have a global network of empowered Filipino patients and caregivers helping in my advocacy. I co-founded #HealthXPH, the first Philippine tweet chat on social media, healthcare, and technology. We gather 7 million impressions weekly. This is our founder's picture in 2015. The night before, we convened 500 people to attend the first Philippine Healthcare and Social Media Summit, from 4 to 500, by word of mouth on Facebook. So I can attest that social media can mobilize citizens, and that is why it is part of the Social Innovators Toolkit of the Harvard Kennedy School. And we don't mean just liking Facebook pages, because as UNICEF says, likes don't save lives. Just hitting the like button to support a cause is criticized as slacktivism. It is feel-good online activism that has zero social impact. This is the matrix of civic activism. The y-axis describes participation. Thin engagement requires you to just show up, vote, sign an online petition, change your Facebook profile, or retweet a slogan. Thick engagement needs ideas, creativity, and input. On the x-axis, we move from symbolic, merely signifying alliance to a cause, to impactful, actually creating change. Slacktivism is thin and symbolic. Voting is thin but impactful. The Occupy movement, unless it leads to change, can be thick but only symbolic. So the challenge then is for us to use online tools to enable thick and impactful engagement at larger scale. In 2013, Typhoon Haiyan evacuees were arriving in Manila without means to get home to their relatives. James Deacon, a motoring journalist, posted a plea on Facebook for volunteers to provide free rides. It was shared 1,500 times in 24 hours, and Oplan Hatid was born. Later, they put up a job fair for the Typhoon Haiyan survivors. That is thick and impactful engagement. In 2014, the ALS, the Ice Bucket Challenge for Lou Gehrig's disease, successfully raised awareness for the rare disease and $100 million worldwide in 30 days. 77 million was given for research and 23 million to support those afflicted with the disease and their families. Recently, researchers funded by the Ice Bucket Challenge discovered a gene linked to the disease, a potential target for drug development. That is an example of click to brick, from online to offline action. Social media democratizes access to information from experts to citizens. Social innovators may be unknowingly replicating the wheel, reinventing it. Those who share their experiences online do so in varying formats across different platforms. Redundance and having the information in silos because of the lack of standards can be obstacles. And that is the same problem we have in healthcare. Health information in silos, benefiting only a few, perhaps harming patients. That's why in health informatics, we endeavor to get the right information to the right person at the right time. Let us do the same for social innovation. What if social innovation can be shared like recipes, ingredients, measurements, instructions? If an ingredient is not available locally, a good cook can substitute. Dr. Belen Dofita's recipe for social innovation in leprosy can be adapted elsewhere or for another disease. If you put social innovation cases online, please label them with a public domain or a Creative Commons license to enable sharing, content reuse, and remixing. In the millisecond it takes to retweet something, having to ask permission to share is an obstacle. What if Dr. Phyllis, our contact details were online? The serendipity of social media can allow for chance encounters, forming loose connections for possible collaborators. In this era of information overload, where everyone competes for the scarce attention that people have, imagine Alice in Wonderland stumbling on a bottle that says, "Drink me." Your social innovation in a bottle should sparkle and say, "Free to copy and improve." Social media allows the social innovator to capture and organize citizen feedback. So when we have recipes, it ensures consistent cooking. A source code is the recipe that the computer runs. When software is open source, it means the code is freely available online for anyone to use, improve, to help others, and to redistribute back into the community. What if social innovation was open? Imagine the global citizens who contribute cognitive surplus to update Wikipedia. Ordinary citizens who have the do-it-yourself attitude in the maker movement. Or netizens who have the hacker mindset of paying it forward. Imagine them as your co-creators of social innovation. Lillian Ricod says that social innovation recipes should be made visible to as many people as possible. If it were a recipe, it should not be a safeguarded secret. No one should have to ask, what is the secret ingredient? We should allow and facilitate sharing by actually giving tips and tricks on how to do this, like Julia Child's Demystifying French Cooking. We should allow and facilitate others to do our work similar to ours by providing free licenses, improve on it, and to make new recipes. Social media allows for crowdsourcing, creating communities of innovators where new and improved recipes can actually be incubated. Social media can foster alliances between bees and trees. Mulligan calls those mobile and active, agile individuals with small groups or small organizations that are abuzz with ideas, the bees. But the bees may lack resources and have no clout. But the trees, these are the governments, big organizations, and companies. They are resource-rich, they are resilient, and rooted. Marvis and Jarvis says that maybe the bees should look for the trees that they can partner with to expand their reach, and that the trees should look out for bees with the same mission so they can help them scale. These trees can also act as social innovation brokers, introducing the bees to other trees. Or they can act as institutional entrepreneurs, providing the environment where social innovation can actually flourish. So in the audience now, who are the bees? And who are the trees? If you don't find each other today, seek each other online. Have I convinced you that social media can help social innovation to scale? It can mobilize citizens, democratize access, organize citizen feedback, and foster alliances between bees and trees. Margaret Mead said, "Never doubt that a small group of thoughtful, committed citizens can change the world." What more can social innovators do with social media? The future is open. Come, let us change the world.